Hello, namaste everyone. I'm Abhipsha and welcome to my YouTube channel. So today in this video, I'm going to burst certain myths regarding the PLAB 2 exam. Yes, you heard it right. So without wasting any further time, let's get started. So what I have done is I have noted down the points so that I do not miss out on any myths that I have come across, and I make proper justice to this video. So the first myth I'm going to burst is NHS has scarcity of doctors and that's why the GMC examiners are just sitting to pass you. It's a myth. Please do not fall for these things. You know, GMC examiners are only going to pass you if you are a safe doctor. If you have the qualities what they are looking in a doctor or in a junior doctor, then only they are going to pass you. Okay. So when I say safe doctor, it means that suppose a patient, you are in an emergency setting and a patient is coming to you, you are in acute setting and a patient is coming to you, how you are approaching the patients, how you are ruling out all the life-threatening diseases, making sure that whenever you are discharging a patient or referring a patient, it should be in a proper way and not haphazard. Second thing is, suppose a patient is, for example, if a patient is coming with headache, okay, and you are not ruling out subarachnoid hemorrhage, you are not ruling out giant cell arteritis, so you are definitely not a safe doctor. If a patient is coming to you with pulmonary embolism and you are not asking the relevant questions, you are not suggesting any relevant investigations, so definitely you are not a safe doctor. So even though NHS is looking for doctors, but it does not mean that they will just take you like that. They are very, very particular. So be prepared and give your best shot on that day, okay? So my second myth that I'm going to burst is reading notes makes you scripted. No, the notes which are provided by your respective academies or from wherever you are reading the notes or the cases, please go through them properly, read the managements, read the advices. Okay, reading notes is never going to make you scripted. Scripted means if you are mugging up the case and you are expecting that the similar case is going to be there on the day of PLAB 2 exam. Okay, so that's when you get scripted. But if you're reading your notes, you are just getting prepared more and more. You are going to become more confident. Your interpersonal skills are going to develop. Whenever a patient is asking you any doubts, you are well prepared to clear the doubts of the patient, right? So my advice would be please read notes and make your own notes as well. Make your own approach. Be natural, right? So yeah, reading notes is never going to make you scripted. But whenever you are going on the day of your exam, make sure that you enter each cabin, that is like enter each station in an open mind. Do not get enclosed and do not force yourself to be just seeing a case in a single direction. Have an open mind, and that's when you are definitely going to do really well in your exam. Okay, so the third myth that I'm going to burst is academic mocks are similar to the PLAB 2 exam. No. One thing I would like to say that your main vision while you are appearing for any mock exam before your PLAB 2, it should be that learn a better time management. Okay, make sure that without getting mentally fatigued, you are able to perform all the 16 stations. Okay, and do not rely on the marks that you are getting in mock, because it really does not matter. If you are getting less marks, do not get disheartened. If you are getting a really good marks in your mock, do not get overconfident. So the main thing what you can do is make sure that you are managing the time really well. You are able to reach to the management part, giving them lifestyle advices and everything, and not just sticking to the history and examination part. So go for better time management. Second thing, do not follow everything whatever your mock examiner is saying. If you are having any doubt, you can always go to the NHS website and read any topic from there, because there were a lot of topics which were not present in my academic notes, but I did find them in the NHS website, those topics, right? So you can always approach in that way, but do not rely on your mock marks. Okay, so the fourth myth, you can just pass PLAB 2 in 1 to 2 week preparation, but the reality is not that. Okay, my suggestion would be always have a good amount of time in your hand before you sit for the PLAB 2 exam, so that you are well revised, you have done all the recalls, and you really know what you're going to do, okay? And you are well confident, and the confidence will only come with a good preparation. Make sure you are prepared well. You know, there are a lot of doctors who have also passed in 1 to 2 weeks, but it's very subjective. It does not apply to everybody. Maybe they have a lot of experience in their home country, maybe they are really safe doctor, they have prepared well in their home country, so it varies a lot, guys. So please do not fall for this myth that just 1 to 2 weeks preparation is more than enough to prepare for PLAB 2. Give yourself a good amount of time, and judge yourself, record yourself in the video camera whenever you are performing a station. And yes, of course, have partners, as I said in my earlier videos as well, and be honest with your partners as well while judging them, right? So moving on to the next. So the next myth that I'm going to burst is, if your interpersonal skill is good, then you are definitely going to pass. No, it's not like that. I have seen a lot of candidates who had really good interpersonal skills, but they didn't manage to pass. The only reason was not because they are not good doctors, they are excellent doctors, but the reason was that most of them didn't score well in the management part. See, the PLAB 2 is scored on 3 criteria, right? One is the data gathering, which includes history taking and examination. The second part includes your management skills, and the third part includes your interpersonal skills, right? Interpersonal skills will come naturally to you when you know the case, when you are well versed with the case, you know how to manage a patient, you know how to explain the diagnosis in common words. So it's very important, and you need to work on those 3 criteria and not just on the interpersonal skills. Make sure you have a good interpersonal skills, but at the same time you have to look for those 3 criteria, because you will be marked on these 3 criteria separately in order to pass the exam. So do not just focus on your interpersonal skills, okay? Moving on to the next one, the 6th myth, keeping the management part too much clinical. Yes, whenever I am saying management, it includes your investigation, includes your treatment, and please involve lifestyle advices. If you are seeing that your patient is smoking cigarette, or does not have a very good diet plan, or just suffered from a minor heart attack and still having a lot of cholesterol in their foods, so if you are not managing the patient head to toe, then you are not a safe doctor. So make sure that along with the management, do not keep it too much clinical. That means do not just talk about what medicines you are going to give, do not just talk about what drugs you are going to prescribe. Talk in a whole, along with lifestyle advices, what investigations you are going to carry out. If the patient is asking you, allow the patient to ask the question, listen to them very carefully, okay? They might give you certain clue. So yes, that's what I'm saying, that do not keep the management part too much clinical. Involve lifestyle advices. Like if a patient has come to you with rashes, okay, so you are supposed to give some advices, so that he gets relief, and not just by medication. Like, do not scratch your rashes too much, and do not wear tight clothes, right? So these are a few lifestyle advices that always comes handy, and it shows that you are really good doctor, right? So the 7th one, using too much of interpersonal skills. Like if a patient is coming with headache and you are being over dramatic and saying, I'm really sorry that you are having headache and all. In real life, NHS doctors do not speak like that, and nobody speak in NHS in this way, okay? I have done my clinical attachment in Royal Derby Hospital, and I didn't come across once who talks like this. They have a very normal conversation, very natural. So one thing I would like to advise you, that please be yourself. Be extremely natural. That's what they are looking inside you. So be very natural. No need to be over dramatic. If a patient is asking you certain question, and you are able to explain to the patient and checking the understanding of the patients, being compassionate, so this shows that you have a very good interpersonal skills. Just saying sorry or thank you, or feeling sorry for the patient does not include in interpersonal skills. There are a lot more to it. So yeah, take care of that. Right. So the 8th myth, taking a very long history, right? So the reality is that when you are taking a long history, that means you are not prepared well. You have to be very, very relevant when you are taking history, and because you have to manage your time as well, you have to manage the patient, you have to give lifestyle advices, give them leaflets and all. And yes, warning signs are very, very important, guys. If a patient is coming to you with acute symptoms or an emergency setting, you need to warn them about the the red flags or the warning signs, what they should avoid, when they should be cautious, and when they should come to the hospital. So you need to take care of all these things. So a good doctor means you're taking care of the entire patient and not just the disease, right? So be particular in this, and I hope I'm helping you in all this, right? So do not take a very long history. As I said, that when you start reading your notes properly and make your own notes as well, you will see that you will have a very structured history, with a lot of practice. Then you will see at the end, at the end days of your exam, you will notice that you are going to take very structured history. So it's a very good exam that is definitely going to evolve your skills as a doctor. Your clinical skills are definitely going to improve after giving this exam. Trust me on this. Okay, so there are few tips that I have with me, and I followed these tips, and that those did help me during my exam. So the first tip is engage the patient with your conversation as much as possible, right? When you are engaging the patient means when you are saying 2 lines and checking the understanding of the patient. Because sometimes what happens that we are just talking a lot and expressing whatever medical knowledge we have, and the patient at last says, "Doctor, I didn't understand a single thing." So this is really wrong. This is a very wrong way to approach. What you can do is, suppose they ask what is a heart attack, and you explain what a heart attack is in a very layman term, and then you are going to check the understanding, that are you following me so far. So there are a lot of statements that you can use while checking the understanding of the patient, like, are you following me so far, or are you with me, and do you have any doubts, do you have any questions regarding this. So please make sure that you ask all these things and keep checking the understanding of the patient. Tip number 2, keep practicing the prescription stations with a timer. It's very, very important. Prescription is no doubt, it sounds very easy, but when you actually perform it practically, it seems pretty difficult. It seemed pretty difficult to me. I don't know about other doctors, but I found really difficult to do the prescription with a timer. I always used to fall short of time. So my third tip would be, keep a habit to open the BNF in respective stations where the positive factor is a drug side effect, etc. Yes, so there is a case of there might be a case of glaucoma, and when you take his proper history of the patient, amitriptyline has a side effect to cause glaucoma. So make sure that you take a good history, then the patient is definitely going to give you a positive history, and you'll find out that, oh, so this is a drug side effect. Then you need to check the BNF. There is a book which is always kept in every station, and you can always check, keep a habit of checking the BNF even when you are practicing before the exam. Tip number 4, keep practicing and reading your notes. I'm always going to say this because I have myself experienced that I read my notes really well before my exam, and I could say that I was really, really confident when I went to appear for my PLAB 2. And tip number 5, the last tip, that do not take any stations for granted. Read all the stations, and that's why I say that 1 to 2 week preparation is never enough. Have yourself at least the people who are beginners, who have no idea, 2 months or 1.5 months time for preparation is well and good, but not 1 to 2 weeks, guys. You can have more time for preparation, but not lesser than that. So with this, I'm completing this video and hope to see you sooner. All the very, very, very best to everybody.